The most underdiagnosed and poorly understood form of dizziness is one that we happen to see quite often because there's so many patients out there who are not getting answers. And the reason for this is called cervicogenic dizziness, which means it's dizziness that's coming primarily from your neck. And it's underdiagnosed because most practitioners are looking at the brain or the nervous system for the cause, the vestibular system, or the cardiovascular system. And when they don't find any reason for the dizziness to be coming from those three systems, sometimes practitioners are at a loss for what could be causing the symptoms that a patient is experiencing. And so what's going on with cervicogenic dizziness is that you have poor information coming from the neck that feeds into the brain, and that creates a mismatch between what your eyes are telling your brain, your balance centers are telling your brain, and what the neck receptors are telling your brain. These receptors are very similar to the ones that you would find in a phone that can detect angular motion. And when you have damage to the neck from trauma, like car accidents, concussions, or postural issues that have come about over a long period of time, or just arthritis and aging, those are the things that can set you up for this. And so there's no specific test for cervicogenic dizziness, but there are a battery of tests that we can use to make sure that this is the right diagnosis. So if somebody's already seen the other providers for the conditions I discussed earlier, and that's all been ruled out, then what we're going to be looking at is, how does the neck move? Is there poor range of motion? Is there pain? Is there intense tension in the neck muscles around the upper body? Another one would be doing testing to see if their joint motion sense is working or not. And so we can actually test the joint proprioception and see if there is a mismatch occurring. We do that with a laser guided system. We also have a force plate that patients can stand on, and the force plate allows us to have the patient put their head and neck in 10 different positions, and if we see a radical shift in their balance, which we can measure with the plate, then we know that this is most likely affecting them. There is also an ability to put vibration on the neck, and sometimes when you put vibration on the neck of somebody who has cervicogenic dizziness, it will actually make them dizzy. So that's another good test that maybe you could try at home. Between that and a tight neck, that is something that you could use to help cue yourself into having cervicogenic dizziness. So that is one of the most underdiagnosed conditions when it comes to dizziness, and something that we get phenomenal results with. And if you have any questions, comments about this condition, feel free to post them.